Hi, this is Dr. Perez Guri, Medical Director at Miami Sunset Surgery Center. I am pleased to inform you that the governor and the state has once again lifted the temporary ban on elective surgery. This should make you, and it certainly makes us, very happy. This COVID-19 crisis has been a pandemic, has affected every country. And obviously, we at Miami Sunset Surgery Center take safety of the utmost importance. In doing so, we've set up some protocols that are going to be very important for you to follow if you are to have surgery done at our center. First and foremost, there will be no one but the patient allowed into the lobby. This is for social distancing purposes. Your friends, your families will either have to wait in the car or go somewhere else while we perform your surgery, and someone from the staff will contact you. Upon arriving at the surgery center, we should be able to have all of your information that has been previously submitted. All patients need to have a COVID-19 test. Our preference is an RT, PCR. We're looking into the possibility of a saliva test being just as good, and maintaining the standard of care. Once you arrive at the surgery center, someone will greet you. They will be behind a screen, a plexiglass screen, which is usually called a sneeze screen, and all information will be transferred from there. The first thing you'll have done is your temperature taken, and that will be done with a thermometer like this. Put it close to your forehead and you get your reading. So this is a no touch right now. If you are of normal temperature, and normal temperature we consider 99.8 or below. According to the CDC, 100.4, less than that would be considered normal. We are taking extra precautions and having no one reach the 100-point mark. You will then be passed into the actual surgery center where all the action takes place. We will give you shoe covers and you will be wearing a mask. Immediately, we will take you to the restroom where you will change from your civilian clothes or your outside clothes into one of our hospital gowns. Immediately, you will be taken into the preoperative holding area cubbyhole. At that point, you will be interviewed by anesthesia. I will greet you. I will make some drawings, at all times wearing a mask. Surgeons and surgeon staff have been provided with these types of masks that are N95 surgical masks. This is what is recommended by the CDC currently and all of the associations. I put in a great deal of time in looking up multiple webinars from our national societies, looking at CDC data to compile the protocol that I'm talking about. It may vary because, as you know and you've been listening to the news, it frequently changes from day to day. And we will adjust because, after all, patient safety is our goal. There is no cost that can pay for someone coming in who's been through the COVID-19 or who has tested positive, even though you may not have exhibited signs. At that point, once we're ready to take you into the operating room, you will be wheeled in a stretcher. You will be transferred to the operating room table, and at which time the anesthesiologist is going to put you to sleep. Following protocol, the only people to be in the room at the time that you are being intubated and extubated will be the anesthesiologist and one or two circulators, nurses at the most. your surgery will be finished. You will go back to the cubbyhole, this time in the post-operative care unit or the PACU, recovery room. At that point, you will recover as long as it's necessary. You will then go directly, when you're ready to be discharged, to change from your hospital gown back into your civilian clothes, and then you will be wheeled out to the waiting person downstairs. Please make sure that you inform your relatives and your friends that you will not be able to stay at the lobby during the period of time that your surgery and your recovery is taking place. The staff will contact your family or friends. This is in keeping with the current protocols that are being suggested by the CDC, the American Society of Plastic Surgeons, and the American Society for Aesthetic Plastic Surgery. Like always, and I keep reminding you, safety is our main concern. So we want you to be safe, and then we want you to be happy with your post-operative results. Until then, I will see you, and continue to stay safe.